The X10, I think, has helped me a lot with inflammation. When I get off the machine, my leg feels lighter. It feels more mobile, more flexible. Okay, my name is Betsy Conti. I'm 52 years old. I think I've had problems with my knees all my life. They hurt as a kid. I think it was kind of ignored and it was considered growing pains. Over the past 5 years, my knees slowly got worse and worse. I was wearing braces on the knees. I was taking pain medication to play tennis. I had my surgery on June 3rd, 2014, with Dr. Kwartowitz and Dr. Lederman. I had bilateral knee surgery, so both doctors were in the operating room. They had planned on doing one knee each, so one doctor was going to be on one doctor was going to be on the other. They opened both knees and saw how bad they were and ended up both working on one and then going and moving on to the next one. Dr. Lederman actually said that I was in the top 5 of the worst knees ever that he's done. And I had decided, especially since I was doing 2 knees, to go into a rehab facility. And I was there for a week. I took the X10 or had it brought in with me. I did get on it every day, at least once or twice. I want every chance I can to get better. So it's one more step in the process. And I think one of the better steps, because you only get physical therapy for an hour or 45 minutes, which really didn't work my knees at all. Now that I'm down to just 3 days a week of physical therapy, it's a definite it's my physical therapist when they're not there. I am about 3.5 weeks post-surgery. On my own, I can get to about 110, 115 on my left. On my right, I get to about 110. That's about it. With the X10, it gets me to 125, but I'm working on that and continuing to do more with it because it's getting me there. Once I get to the 125 on it, that 115 doesn't feel as bad. So as I work up to 130, the 125 won't be as bad. And I want to get as much flexion as I can. And you really have to do it in the first month of post-surgery or you lose it. Actually, when I get off the machine, walking is a breeze because I have that motion. In 3 weeks, I can tell a difference. My knees feel great. They're doing good.
X10, back to full strength.